I'll be informing you on diabetes mellitus, also better known as just diabetes. Diabetes is a health condition that affects people of all ages and all ethnicities. As a college student and as a young adult, you may be already working towards getting this disease and you might not even know it. So I'll be informing you on the definition, the signs and symptoms, as well as ways to prevent this disease. Diabetes has two types, type 1 and type 2. In type 1 diabetes, you're born with it. So if you don't already have it, you don't need to worry about it. But type 2 diabetes happens because of poor lifestyle choices. In type 2 diabetes, your body does not properly convert your food into energy. So when you ingest your food, the sugar from your food goes into your bloodstream. So at the bloodstream, the sugar waits for insulin from your pancreas to come help it move from the blood into your body's cells in order to produce energy. So in type 2 diabetes, your body doesn't use insulin properly. So because insulin isn't used properly, the sugar at your blood just stays there and accumulates instead of moving into the cells. So if you have high blood sugar all the time, you can have negative consequences such as getting heart disease, vision impairments, as well as kidney disease. Heart, vision, and kidneys is very important for your body to function safely and also normally. So the signs and symptoms you should look out for diabetes is frequently having to urinate, frequently thirsty, frequently hungry. You may have some unintentional weight loss, feeling some numbness and tingling in your hands and your feet. Also, if you are getting infections more recently, more often than you usually do, you also may have some blurry vision. So these are things to look out for. So risk factors of diabetes is being overweight, being middle-aged, 45 years or older, if you have any family history of this disease, and if you participate in little to no physical activity at all during the week. Another risk factor would be if you are African American, Latino, Hispanic, or American Indian. Unfortunately, the rates of diabetes is increasing now in today's generations because we don't really participate in good lifestyle choices such as exercising and eating healthy meals. Many of our youth are obese nowadays, and so this increases their risk of getting diabetes. Although diabetes is a disease that mostly affects you later on in life, in your 40s and up, many of our youth today are getting diabetes early because the obesity rate is increasing. So, like I said, proper diet and exercise really helps control your blood sugar and just keeps you healthy overall. Exercising can actually naturally reduce your blood sugar in your body, so you don't really have to depend on insulin all the time. Just making those good choices in life, like eating healthy foods and exercising, can do that naturally for you. So in the journal article, Feasibility of Implementing Community Partnerships to Provide Diabetes Prevention to the Youth, the author, Julie Pikes, she actually presents 7 points in reducing your risk of getting diabetes. So those points include choosing water, avoiding the sugary drinks, choose fruits and vegetables, eat breakfast every day, eat healthy snacks, and also practice portion control, eat home-cooked meals, and participate in physical activity daily. These are really important in reducing your risk of getting diabetes. So many of us today in our generation fall guilty of making poor lifestyle choices, myself included. We don't really participate in physical activity, and a lot of times we go for the easy food choices like fast food restaurants. But unfortunately, this puts us at risk for acquiring diabetes. Many of us also don't really know knowledge of this disease, and we don't know how to nourish our bodies properly. But after obtaining this information, you have more knowledge on diabetes and the prevention and what to look out for. So you have gained knowledge on this disease. It's very preventable, and so this will help you not acquire this disease later on in the future. If you have any further questions on how to eat healthy and how to participate in a healthy lifestyle, I suggest and recommend visiting the website choosemyplate.gov and more resources and additional information will be provided for you there.